Moments after the bill passed, we started seeing statements from lawmakers on both sides of the aisle and Indiana organizations that are concerned about its impact on Hoosiers. WRTV's Nico Panisi has the latest.
Indiana's Republican representatives are touting their work passing the so-called Big Beautiful Bill. Congressman Jim Baird said, quote, "This bill delivers the largest tax cut in American history for workers, families, and seniors by ending taxes on tips and overtime for millions of workers and slashing taxes on Social Security." Congressman Jefferson Shreve also came out in support of the bill, saying, quote, "The bill provides for our largest investment in our border and national security, and it puts America on a path towards faster economic growth." But the response isn't all positive. The Indiana Democratic Party issued a statement Thursday condemning the bill. State Representative Carrie Hamilton says thousands of Hoosiers are now at risk of losing access to food and health care.
This bill will likely close 12 rural hospitals across the state of Indiana, and 230,000 Hoosiers will lose health care.
The bill would essentially defund Planned Parenthood. President and CEO Rebecca Gibron says this puts our most vulnerable Hoosiers at risk.
For Planned Parenthood, that means life-saving cancer screenings, breast health exams, well person exams, access to birth control.
The bill will also impact food insecurity programs. Mark Lynch with Indy Hunger Network says the federal government provides roughly 80% of all money for the food insecurity system. That includes school meals, WIC, SNAP, senior meals, and all kinds of federal programs.
Even a small decrease from the federal government increases the lines at all of our pantries. And this is something that we've already seen in the last couple of years as food insecurity has continued to rise.
The bill could also be devastating for families of medically complex children and adults. Jennifer DeWitt with Indiana Families United for Care calls this a matter of life and death.
I have a child that depends on his Medicaid to get feeding supplies and to get his respiratory supplies, and without Medicaid, his option would be to be institutionalized or to frankly die.
In Indianapolis, Nico Panisi, WRTV.